I do research into multiple myeloma. Multiple myeloma is a blood cancer. In myeloma, you get cancerous proliferation of the cells that live in the bone marrow that are responsible for making our antibodies. This protein level in your blood gets very high, and that can cause unexpected side effects such as kidney failure, disruption of the immune system. The little clusters of cancer cells melt holes in the solid tissue of the bone and then can cause bones to collapse and fracture. So it's a cancer with some really unpleasant side effects. Multiple myeloma, sadly, is not currently curable. Although we have, in the last 20 years, had unbelievably exciting progress in the way that we treat this cancer, we still can't get rid of it altogether. And therefore, when someone's diagnosed with myeloma, that is a lifelong disease. One of the challenges in myeloma research is to think about how we can give patients the best combinations of treatment that keep them well, rather than give them unpleasant side effects, as well as prolonging their life as long as we can. It's a very expensive disease to treat at the moment. Because we can't cure it, people have to have treatment for the rest of their lives. So what we would love to do is to make our treatments more cost effective and easier to tolerate. One of the things that we in the myeloma research community could do best would be to collaborate more together. We need to work together coherently over the whole spectrum so that our basic research ends up making a difference to patients' lives. I think it can feel quite isolating to suffer from a rare disease. I know that in the myeloma community, people find it extremely useful to be part of patient support groups. Getting involved in advocacy can be really hugely rewarding for patients and help them feel like they have a community who knows what they're going through. Although we still don't have the cure for multiple myeloma, it is an extremely exciting time to be doing myeloma research in clinical trials. We've had a lot of new therapies that have come through clinical trials and are beginning to now be adopted into clinical practice. In particular, the sorts of therapies that harness the immune system to attack the cancer cells. It's been a really exciting time to be involved in myeloma research, and I'm sure it will continue to be so. And I think we're going to make a real difference to patients' survivals and quality of life.